Hello there, it's Dr. Jim, and I have another interesting topic for you. There's actually a trend that's been going on for 10, 15 years, but the numbers involved in this trend have accelerated over the last few years. What am I talking about? I'm talking about younger adults moving into skilled nursing facilities across the country. This is part one of 4 parts. This topic, I've actually created a 2-hour continuing education presentation based on this topic. There's so much information. But this is Younger Adults in Skilled Nursing, Part 1, and I'm going to focus on who they are and why they're there. Okay? So, a new trend not seen before in skilled nursing has been developing over the past couple decades. Here's some numbers to consider. In 2000, young adults between the ages of 31 and 64 made up 12% of the nursing home population in the U.S. 10 years later, in 2010, the number rose to 14%. And in 2022, the National Center for Health Statistics reported that almost 17% of nursing home residents are under the age of 65. So what does that mean? Well, it's safe to say that nursing homes are no longer synonymous with old age care or geriatric care because the population is getting younger, a sizable amount. So why is this trend occurring? Well, we have to follow the money, right? The Medicaid expansion of the Affordable Care Act made this possible. Historically, there has been nowhere else for younger adults to go who were living with conditions like traumatic brain injury, HIV and AIDS, serious injuries due to motor vehicle accidents, drug overdose, hemiplegia, quadriplegia, severe mental illness, and neurodegenerative diseases. There was no place for them to go. The significant increase in younger people moving into nursing homes followed the Medicaid expansion of the Affordable Care Act, which covers nursing home services and stays for younger adults. Although, here's the point. This could be like a very ethical type of discussion that we're having here. Although younger people with these disorders have a place to live for either short-term or a long-term stay, what remains unclear are the benefits from this type of care setting, and if the needs of these younger adults can be met in a geriatric setting. All right? So who are these folks? Younger adults between the ages of 16 to 64, anybody under the age of 65, are very different from older adults and seniors who are living in nursing homes right now. Besides their age, which is obvious, they're younger, their physical, medical, social, psychiatric, substance abuse issues, and more make them a unique group. Some enter the facility with developmental or intellectual disabilities, trauma-induced hemiplegia or quadriplegia. They have higher rates and greater severity of psychiatric illnesses and substance-related diagnoses. Others are admitted with chronic neurological conditions like muscular dystrophy, Huntington's disease, Parkinson's disease, amyotrophic lateral sclerosis, ALS, and peripheral vascular disease, and that's just naming a few. There are many more we could talk about. What also makes them different? And who are they? Many have had previous stays in psychiatric hospitals or rehab centers for substance-related conditions, co-occurring disorders with mental illness and substances. Rates of anxiety, depression, and suicidal behaviors are higher in younger adult populations in skilled nursing than they are among older adults and seniors living in nursing homes. So why the anxiety? Why the depression? They can be associated with the possibility of living in a nursing home for the next 20, 30, 40 or more years. Now, that's something to think about. Say you're in your 20s, TBI. Now at least you have a place to go. But the skilled nursing home is going to be your home potentially for the rest of your life. So that can be very, very depressing in and of itself. This creates unique concerns, dilemmas, problems for the staff who are used to treating and caring for older adults and seniors, not younger adults. So they may need specialized training and education. They may have to change their approaches in how they deliver care. Okay, so what we have, two really different populations under one roof. Let me explain. Younger and older adults in nursing homes are uniquely different in a variety of ways, some of which I've already touched on. The majority of younger adults are male, whereas among older adults, they are mostly female. Big gender difference right there. White people make up the majority of older residents in nursing homes, whereas Black and Hispanics make up the younger group. So we have racial differences. Serious mental illnesses and psychiatric conditions and medications are far more common among younger adults. So now we have mental, cognitive, psychiatric differences. Younger adults also have greater rates of cerebral palsy, paralysis, TBI, traumatic brain injury, multiple sclerosis, diabetes, and even ventilator use. So here are my final thoughts. The landscape, the population of skilled nursing, we're not talking about assisted living, skilled nursing, is changing. It has been changing over the past decade or so. And the population is getting younger on average. It was very rare. I have to tell you, I've been working inside of nursing homes for the past almost 35 years. And where I have met a handful of younger people here and there, especially in inner city, urban nursing homes, it was more rare than it is now. Now, it's fairly common. And I continue to ask administrators and clinical directors all over the country, how many younger people have you admitted? And they're like, oh, we've been admitting them for 5, 6, 7, 8 years now. So it's becoming more common. Again, the younger resident is considered anywhere between the ages of 16 to 64, but their characteristics are completely different from your traditional older senior resident in nursing homes. The younger people have more severe health conditions, trauma-induced injuries, neurological disorders, substance use / mental health issues that they are dealing with, and sometimes way more severe than you would find among older adults residing in nursing homes. So with the changing of this population, my bottom line here is that nursing home staff across the country, if you're going to admit these folks, then you're going to need specialized training. Person-centered care, for instance, for younger adults, way different than person-centered care for older adults. Resident rights. Are younger people going to want more rights? Are they going to demand more rights? Are they going to know their rights so well that they have their attorney on speed dial? Only time will tell. There you go. I'm Dr. Jim. I'm signing off, and I would like to wish you the very best in health, wellness, and happiness. Well, I certainly hope you enjoyed the video, and thank you very much for your time. If you'd like more information about a great online learning management system with the most wonderful support, best in class support, and partnering, please look for the link to the website in the description. You'll love what you see.